Good afternoon, Columbus. Troy again with Ohio Men's Health. Welcome back to our Frequently Asked Questions video series. So today's frequently asked question that we're going to discuss and tackle today is what happens both short and long term with testosterone replacement therapy. We get this again through the website, and it's also a frequent discussion that I have in the office when I'm meeting with folks who are starting testosterone replacement for the first time and are relatively new to it. As always, before we start, how you can find us. You can go to columbuslowt.com. So you just go to columbuslowt.com. You'll find our website there. You can request a no-cost initial consultation. You can contact us directly, 330-662-1030 by phone and or text to that number. Then, of course, you can subscribe to us here on YouTube. That's wonderful. So as we put out new information, it just pops right up in your inbox. So subscribe to us on YouTube. You can also find us on Facebook and TikTok just by simply searching Ohio Men's Health. So let's talk about it a little bit, both short-term, long-term. What do we see? So short-term expectations. We talked about expectations in a previous video, but what to expect with it. So what to expect short-term is most men within the first 2 to 3 months are going to begin noticing little subtle changes. Increased energy, better mental clarity, better mood, so maybe just a little bit more excited, and better cognition, memory, recall, that brain fog that we tend to feel. Those are the things that we typically see most men see short term. Now that's short term, and then long term. So short term, you're gonna see some of those symptoms improve, which are the primary thing that we're taking care of. So those are the things that we're trying to manage, your symptoms. Now, number two, the long-term effects are typically for number one, lean muscle mass. Absolutely, we're gonna see lean muscle mass develop over months 3 to 6, and then as you continue on with testosterone replacement therapy, your body's gonna respond. As long as you're in the gym, eating right, and doing all the right things, you should see lean muscle mass. Number two is strength. You're going to see some strength return in the gym. You know, if you're my age at 50, perhaps maybe a little older, even into your mid 40s, you see some of that decline. You may not be back to where you were in your 20s or 30s, but you're gonna see that you feel a little bit more powerful and a little bit stronger in the gym. Number three is you're going to begin to see better bone density. Now, that's not something that you can see, but this is something that can occur long term. And the reason that this occurs is that with testosterone, one of the byproducts of testosterone is estrogen. Now, of course, we got to balance that estrogen, but if testosterone's low, we typically don't have enough estrogen, which can lead to some demineralization of the bones, much like a postmenopausal female that doesn't have enough estrogen. And as testosterone levels go up, we begin to manufacture more estrogen. We see that the bone density is improved. Testosterone does improve bone density. And then, of course, the last one, which studies are beginning to show, is that cardiovascular health is actually improved with testosterone replacement therapy. And as a men's health clinic, that's a big area that we focus on is cardiovascular health. Both the lipid profile, calcium scans, cardiac CRPs, there's a lot that we look at for cardiovascular health, but long-term, it does improve the cardiovascular health as well. So those are the changes that you can expect both short and long-term from testosterone replacement therapy. And then again, we always have to be monitoring for side effects, which we will be talking about in another video. But these are our short-term, long-term benefits. Again, if you're looking for us or want to consider a no-cost consultation, you can go to columbuslowt.com, subscribe to us here on YouTube, look for us on TikTok and Facebook. These videos also cross-post over to those platforms. We appreciate you listening to us, and we look forward to seeing you next time.